Have you heard of growth factors, exosomes, peptide infusions? So you want to look 5, maybe even 10 years younger without fillers or anything synthetic. Well, you likely want something called PRF, platelet-rich fibrin, your own stuff. This is an absolutely important video today, and you're going to see a side of me you rarely do. This is what keeps me up at night, and it's what I talk about at congresses. It's what we call autologous, meaning it's from your own body. Exosomes, growth factors, and mesenchymal stem cells, and my team has just measured and proven exosomes of your own, not from other people, which is what you want, are found in the aliquot, in the spin, as I'll demonstrate to you today. And keep this image in mind. When you see her walk into the clinic in a moment, she would have had some dissolved. But how do growth factors, exosomes, PRF, and peptides come into play with this procedure? Or face fat loss? The problem is most clinics are going to offer you these products, growth factors, exosomes, and stem cells that come from, guess what? Other people. And I know you don't want that. I want to review a before and after of a 15-month result of a patient in 3D imaging so I can show you exactly what it's going to look like and what I measure. But before I do, just know it's not PRP that many of you are thinking about. I'll show you exactly why today and why you've seen PRF filler, things like plasma fill, all over New Beauty and Vogue magazine as the 2020s breakthrough. Okay, here it is. I'm in my office. Here's my New Beauty magazine. What do you expect next? This is spring 2025. You guys know I've been telling you about PRF since 2000 and what? 16, 15? But here it is, platelet-rich fibrin. And look, if the idea of injecting filler doesn't appeal to you, rest assured there's a more natural approach. Enter PRF. So you're just starting to see it in the media, but if you followed me, we've been talking about it for 10 years. Thing is, most of you have never heard of it before. On a negative note, many people are going to get it and they're getting fakes, just like they get fake Botox and filler, only it's way easier to get fake PRF. And don't worry, for those of you that don't want a blood draw, there's still a few people that are scared of that. Well, we now have synthetic, non-human derived exosomes, and those are called plasmasomes. I'll link that video at the end of today's video. But your time's valuable, so let me show you how you can tell if you're getting the real deal. You see, if you get the real deal, you get the real results. Makes sense, right? Sounds simple and easy, but it's not. And my team has also just measured exosome counts in PRF. So I'll share that with you too. Okay, so here is the before. There's the after that I wanted to show. Now, everyone's results going to be different just because everyone's at a different stage of facial aging. Their hormones are different and they're going to respond different. That goes with fillers, synthetic biostimulators. It's no different for platelet-rich fibrin or your autologous blood. But this was 2 sessions, 6 weeks apart, and that was a total of 10 cc's each session, so 20 cc's. Sounds like a lot, but that's only comes to about 8 or 9 tubes of blood in total over those 2 sessions. Think about when you give blood, that's like over 30 tubes, something like that. So it's a tiny amount of blood to think that we can get this result from 4 tubes of blood each session. But you can see the under eye, the smile lines or the accordion lines, better jawline, this area is improved, lip lines are improved, and just overall, forget all of that and just say, hey, which one looks younger, this one or that one? And you'll pick that one over here. But I'm showing you this before and after, and the reason is not to say, hey, look at what a great result. And I did a series of patients like this with 15-month follow-up. But the reason I'm showing you this is here. Watch this. This is why. Look on this side. These are vectors. All these little arrows are vectors, and if you can see, if you come close to your screen, you can see the lifting effect because all the vectors are pointing upwards. And so what I'm showing you is that we measure not just by looking at pictures. That's subjective. But we measure with data, and that's the power of 3D image. And every practice should have that now. But that's not enough, because look on this side here. This is heat mapping. If you see the number, look, Red means there's increased volume. That's at 15 months. And of course, I placed this in the cheek area, as I said, the smile lines. And you can see there's an exact number here, 2.93 millimeters right there. Okay, I'll move that marking so you can see. 2.93 millimeters of forward projection. So I know that at 15 months, she still has volume in those areas. What happens with aging over 15 months where we didn't put anything? Okay, well, look at the chin. See the blue? The blue is negative heat mapping. So that means she lost volume here. A little bit of blue here. She lost volume to the eyes there. A little bit of blue in the nose, the nasolabial fold there. Let me remove the marking so you can see that clearly. Do you see the blue in the nasolabial fold there? So we can see where the aging has occurred. All this to show you, we measure with 3D imaging objectively, not just subjectively. And now I know also exactly where to focus on for the next treatments. We age every day, there's always a next treatment. The blue area on the 3D imaging guides us. Now, do you like her lips better here, a little smaller? Well, yes, after using hyaluronidase to dissolve filler, we then add PRF to restore healthy fat pads, to tighten the skin, and allow a natural look. Filler reversing is huge right now. And people forget what they look like. So they might forget that they look like this and came in with this improvement 15 months later, but says, Doc, I don't see anything. It happens gradual, happens over time, but that's the power of your own exosomes, growth factors, and mesenchymal stem cells. Now, before we go anywhere, we need to understand this. There's only so much goodness. This is a 13 ml tube, but let's just 10 mLs for demonstration here. This tube is actually 13. It's a special tube. But take 10 mLs. There's only so many cells in there. We don't want the water. That's not going to make you look younger. Plasma proteins, not going to make you look younger. Let's look at the cells. 41% is red cells. We don't want red cells. This is what we want, platelets and white blood cells. But look at this. There's only almost 3% platelets. That's the most important. We want white blood cells. There's only a tiny amount in there. So when we spin them down, we only really want that portion of the tube. That's why we're spinning it. Why? Because look here, we want to get rid of the red blood cells, the water, and the proteins, so we spin it down. Luckily for us, what's the heaviest things go to the bottom when we spin? Red blood cells are the heaviest, and the lightest is the platelets and the white cells, so they go to the top. It'll make more sense in a moment. Now, if you've lost facial fat from treatments like radiofrequency or ultrasound, think Thermage, Ulthera, HIFU, even RF microneedling, pay attention to this part. Here is exactly why you may or may not get results. Okay, so you can see what you don't want. You don't want this clear fluid at the top. That is what's called PRP. That's the fast spin. Look here, that's a separating tube. What's that made of? Synthetics, like plastic. You don't want that. Here are the red cells. It does a good job of getting rid of the red cells. If you look at PRF, on the other hand, have a look at this. You see it's cloudy. It's full of cells over there. And here's a little trick for those people that are using this product. If you let it sit after you take off the goodness at the top, it will what percolates up to the top? The light stuff. Your growth factors, your exosomes, mesenchymal stem cells, the platelets, exactly what we want. But look here on PRP, that cannot happen. If I remove the markings, check it out. Anything else is being stopped from coming up because of the plastic that's in there. So a lot of people look how much yield I get from my PRP. It's garbage, it's water. Who wants yield? Look over here, you want growth factor, stem cells, mesenchymal stem cells. That's the issue. And if you look here, to make matters even worse, I want you to look down here, right here. Let me remove that to make it even clearer. Because look here, what's that? Well, it's heparin or sodium citrate, a blood thinner. When's the last time you cut yourself, you put that on there to help with healing? It's the opposite of what we want. So there's additives, which also makes it a drug by definition, but that's it for another day. So if you look in our columns over here, look, PRP requires anticoagulants. We saw that here, down the bottom. PRF is 100% natural. PRP is rapid and short-lived because you don't get a fibrin clot formed in the body. So all the growth factor stem cells are released super quickly. You don't want that. You want them released over weeks. That's PRF because it's allowed to clot. Okay, so PRF is sustained and longer lasting. It drips in all those factors. PRP, fibrin network, is not present. And you'll see people try and add prothrombin. Why? Because fibrinogen in your body naturally forms a fibrin clot by an enzymatic cleavage, and that is facilitated by something called thrombin. And so by adding that into the tube, another synthetic, they try and form fibrin even though they've added a blood thinner. Yes, it makes no sense, but that's PRP. That's why PRP is old school. And then, of course, on the PRF side, you get the natural scaffold. PRP have lower, if any, exosomes, a higher concentration in PRF. I'll show you that. And the clinical benefits, therefore, if you look at it for PRF, long-term biostimulation. That's why I looked at patients out 15 months, because the results occur slowly over time. Exactly what we want. Before we go on, if you liked this video and the content I'm providing, click the like button below, subscribe, because most of you aren't subscribed, you're getting benefits, and most importantly, share with your friends. They want this information too. Let's move on. So here's what I'm using over here. You can see there's heat resistant tubes. It comes in packaging. It's labeled. If you look here, you can read here, it's labeled. There's sterility indicators, lot numbers, expirations, all of that. A lot of people try and save $5 and make it up. I get a company that gives them products that are separated with products that are piecemeal together. They don't have labels. There's no sterility indicators. There's no lot numbers, expiration, all the things you want to or you'd expect with something that involves a blood product. So that makes it even more compelling that you want to get the real stuff. Don't worry about asking your provider what system they use. What's the spin? What's the spin time? People who do this all the time, I'm only too happy to tell my patients what I'm using, the spin speed, why. All those questions are great. If your provider is balking at that or not answering that for you, or if the blood's leaving the room and going somewhere else and coming back, all those things, you're not comfortable with that, say so. I put up this slide just to show you when you're making the filler from PRF, you spin your blood, okay, and you heat it. Here's a heater. You heat a portion of it, you cool a portion, and here's your slow spin step. The fast spin to get your albumin that we heat up, there's no real cellular factors that we're concerned of in there. It's the slow spin that gets your growth factors, your exosomes, mesenchymal stem cells, your white blood cells. And then you mix all that goodness, which again, it's only 1.5 cc's per tube, with your heated gel. I can go through the whole thing for you at some point, but understand there's the liquid form and this is the gel form that I'm talking about. Think gel, think instant, think like filler, but with also the long-term goodness that we talked about. The most popular areas to use it, number one by far is the under eye. Nasolabial folds are good. There's a study coming out on that. Marionette, lower face, especially females. That's where you get bone loss, thinning in the skin, and that lower face ages, and of course the face squares as females age, as we all age, but for females, square means masculine looking. So chin and jawline. I love the lips with the liquid, not the filler part. The liquid does a great job, more redness, and it's surprising how well it does with vertical lip lines or what they call smoker's lines. Cheeks, I showed you that. I even have younger patients who use it in their cheeks as well as older patients. Crow's feet, I don't do a lot of. I use the liquid for the under eye, little of the crow's feet, but it does work there. So combination treatments always win, as we know. So the beautiful thing of PRF, they work with fillers, with biostimulators, which are synthetic. If you want that, you can have that. And they work with RF microneedling, lasers, and so on, and with the DermaPen. That's a great treatment. Plasma Glow, GLO.com is just with a microneedle and PRF, and it's phenomenal results because you're getting the growth factors, stem cells into the dermis, and you can go 1 to 2 millimeters, even 0.25 millimeters. That gets the dermis, but you can go deeper. If you want it into your fat pads for fat pad rejuvenation, you want to inject it, and I always use a micro cannula. Now, this is what I wanted to show you. We actually measured TGF beta 1, VEGF, so vascular endothelial growth factor, and platelet-derived growth factor. I don't want to bore you guys. I can do separate whole videos on this. This is hour-long talks. This is the kind of stuff I do. But this is a series of patients. Here's 5 of them. So each patient here, and you can see what we've done is measured the spin speed. So 900 versus 1100 spin speeds, and looked at all the different growth factors. And remember, this is the important point. The spin determines if you're getting growth factors or not in there. And remember, when you spin, it's not just the tube, it's the G-force at the tube, and the G-force is going to be dependent on the angle and the size of the spinner. As things spin around, this is very complex. It's physics and it's hematology. So you don't want too much of a G-force, or again, all the cells are going to go to the bottom of the tube. So the tube matches the spinner. You can't just take any tube, put it with any spinner. You'll get a totally different aliquot. Now, I promised you exosomes, and the best way to measure exosomes is by way of markers that are found on the exosomes. So there's a bunch of data I have. Of course, you guys don't want me to go through all of that, but just to know, I'll show you the next slide here, and we have multiple data points. Here's the next slide. So the markers for the different exosomes, but you want to prove that you have exosomes in your aliquot of the tube and the spinner you're using. So that's the important point. So we have multiple of those. So just know all that data. I have all that data, and exosomes are now proven, along with growth factors and mesenchymal stem cells, to be found in your PRF. But it all depends on the spin. So what you're getting, you want to make sure, ask questions of your provider, but this is what is replacing the fact that the fillers are out of vogue. Filler sales are way down. Of course, you saw recently heads of companies of the fillers being fired, and half of the sales force gone in some cases, because fillers are down, all natural, and biostimulators are up. Ask me questions because it's very complex. You're now going to want to watch this video on all about how LED masks can help rejuvenate the face, and one down here on plasmasomes, the synthetic form of exosomes that we make that don't have human contaminants in them. Keep your skin and body beautiful, healthy, and vibrant.